Welcome, everyone. In this explainer, we are going to break down everything you need to know about dengue fever. We'll make it high yield, super easy to remember, and perfectly tailored for your exams.
Okay, so here's our game plan. We'll start with the basics, meet the enemy. Then we'll get into its secret weapon, this thing called ADE. After that, we'll look at the clinical signs, figure out how to diagnose it, and cover how to fight back with treatment and prevention. And of course, we'll wrap it all up with a rapid-fire revision at the end. Let's get into it.
All right, first things first. Let's get the fundamental facts straight. Who are we dealing with here?
Now let's start with a classic exam question, one that really gets to the core of dengue. Why is getting it a second time potentially so much worse? Keep that question in the back of your mind because we are going to unpack the answer very, very soon.
So the virus itself, it's from the Flaviviride family. For your exams, you just got to remember these key facts. It's an enveloped, single-stranded RNA virus. And crucially, it has 4 main serotypes you absolutely need to know. But the virus can't get to us on its own, right? It needs a ride. And that's where the Aedes aegypti mosquito comes in. Its behavior is what makes it so darn good at spreading dengue. Just remember the mnemonic dandy. It's a day biter, it's an anxious and nervous feeder, which means it flits around, biting multiple people to get one meal. It's domestic, so it loves hanging out in and around our homes. And finally, that's us humans, we're its favorite meal.
Okay, now for the most important part of this whole explainer, the pathogenesis. If you understand this next concept, you understand the core of why dengue can get so severe. This is exam gold.
So after you get dengue for the first time, your body makes antibodies. Some of these are neutralizing antibodies. These are the good guys. They give you lifelong immunity to that specific serotype you were infected with. But your body also makes non-neutralizing antibodies. And these guys? They're deceptive. They're the ones that can cause all the trouble later on.
And this brings us to antibody-dependent enhancement, or ADE. Seriously, tattoo this on your brain. It's a 4-step trap. Imagine this. You get infected with serotype 1. Your body fights it off and creates antibodies. Now, sometime later, you get bitten again, but this time by a mosquito carrying serotype 2. Those old non-neutralizing antibodies from the first infection, they recognize this new virus and bind to it. But instead of killing it, they act like a Trojan horse, helping the virus sneak into your immune cells more easily. This triggers a massive, out-of-control inflammatory response.
And there it is. That's the answer to our initial question. ADE is the reason a second dengue infection with a different serotype can be so much more dangerous. It's the mechanism that can push a patient from a simple fever into dengue hemorrhagic fever or even dengue shock syndrome.
Okay, so we know the how. We know about the enemy's secret weapon. Now let's look at the what. What does this battle actually look like in a patient? This table is incredibly high yield. You need to know how to tell these 3 stages apart. You have dengue fever, your classic breakbone fever, but to call it dengue hemorrhagic fever, or DHF, you need more. You're looking for bleeding, a platelet count that drops below 100,000, and a rise in hematocrit of over 20%. That's your telltale sign of plasma leakage. And if you have all of that, plus signs of shock, like a weak pulse and low blood pressure, that's dengue shock syndrome.
And hey, we love mnemonics, right? To remember the criteria for DHF, just think H, plate. H for hemorrhagic signs, P for platelets under 1 lock, L for leaky capillaries, A for abdominal signs, T for temperature, and E for evidence of plasma leakage. Easy.
Right, so you suspect dengue. How do you actually prove it? Well, with dengue, timing is absolutely everything. This timeline is mission critical. In the first 5 days, when the patient is burning up with fever, the virus is everywhere. That's the viremic phase. So you test for the virus itself using an NS1 Antigen test or RT-PCR. But after day 5, the virus starts to disappear and the body's immune response takes over. That's when you have to switch gears and look for the IgM antibodies the body is producing.
So we've diagnosed it. Now what? Let's talk about how we manage a patient and, just as importantly, how we prevent this from happening in the first place.
Now, this is a huge point to remember. There is no specific antiviral cure for dengue. The treatment is 100% supportive. Your main job is to manage that plasma leakage with really careful fluid replacement. You're basically supporting the patient's body while it fights off the virus, and that means closely watching their vitals and their hematocrit for any warning signs.
So if there's no cure, prevention is key, and that means going after the mosquito. It's a 2-pronged attack. You have anti-adult measures, like spraying and repellents, to kill the mosquitoes that are already flying around. But maybe even more important are the anti-larval measures, getting rid of any stagnant water where they can lay their eggs. That's attacking the problem at its source.
Now, a quick word on the vaccine. Yes, a vaccine called Dengvaxia does exist, but, and this is a huge but, it's only recommended for people who've already had dengue once. Why? Well, it all comes back to ADE. If you give it to someone who's never been infected, you could actually prime their immune system to have a more severe reaction if they get dengue later. It's a tricky situation.
All right, team, we've covered a lot of ground. Let's boil it all down to one final slide. This is your rapid revision. Everything you need in one place.
Feel free to pause here. This is the whole story on one slide. The key concept is ADE. The vector, remember dandy. Diagnosis is all about timing. NS1 early, IgM late. The criteria for DHF, H plate. Treatment is all about supportive care. Fluids, fluids, fluids. And prevention is integrated vector control. You master this slide, you're going to be in great shape for your exams.
And I'll leave you with a final thought to chew on. As our world gets warmer, these mosquitoes are finding new places to live. So the battle against dengue is constantly evolving, which means our strategies are going to have to evolve right along with it. Thanks for watching.